of existing specialties. But look at how few countries have done this. And when we dig deeper, we find that the 4-year training in Britain and Ireland is a 10-week training in Romania, is a 6-month training in some other country. We have to be very careful when we say palliative medicine is established as a specialty in any country to recognize that the same terms are not being used in equivalent ways between countries. So we've tried to look at this in a little bit more detail in the European context, and I've worked very closely with Dr. Carlos Centeno in Spain on a task force of the European Association for Palliative Care, supported by our colleagues here in Milano, to produce, in the last couple of years, an atlas of palliative care development in Europe, the first atlas of its kind. We've tried to look at the numbers of services that exist in the countries of Europe, the inpatient units, the hospices, the hospital support teams, the home care teams, and we've tried to measure these against the total number of inhabitants in each country. We know something about the numbers of specialist palliative care beds that exist in relation to population. We know something about the number of full-time physicians working in palliative care in some of these countries. We've even looked at the level of interest in the scientific journals that exists across the countries, the propensity of any country to produce literature in the palliative care field. And we've looked at the number of people who attend conferences of the European Association for Palliative Care and how they vary between countries. Another measure of the level of interest of palliative care at the national level. In the atlas, and I hope some of you have seen it, you'll also find short summaries of the current state of development of palliative care in all European countries. And I've just put up here the Italian section, 4 pages, which set out the state of development of palliative care in 2004. And I'd publicly like to thank the people in Italy, Oscar Corley and Augusto Carasini, who did so much to help us compile this information and get it as accurate as possible. This kind of work is difficult to do. It poses problems of international comparison, but we're beginning to put together an evidence base of the state of palliative care globally, and in this case at the European level, which we can use with policymakers, with politicians, and in the European context, which we can use to lobby the Commission and the European Parliament about the development of our field and the outstanding needs that we have. We've also been encouraged into what you might regard as a rather dubious science of ranking the level of development of palliative care at the country level. There is interest in this, and people have mixed feelings about it. I'm sure that in Italy, as in the United Kingdom, there's a preoccupation with league tables, not only in football, but for schools, for universities, for hospitals, and so on. Well, we've been encouraged to do a little bit of this for palliative care. And we started out by trying to look at the level of specific resources for palliative care that exist in European countries that can be measured in relation to population, the number of hospital teams, support teams, home care teams, beds, physicians. And we were able, on the basis of gathering that information for all 27 countries in the European Union, this is a piece of work that we just concluded this summer, to rank them in terms of their standing and level of development. But that all seemed a rather simple and crude measure of development. We were also interested in what we are calling the vitality of palliative care in a country, not just as measured by the number of beds or the number of doctors, but by some other, what we might call softer measures, the existence of a national palliative care association, whether or not a country has a directory of palliative care, the numbers of people from a country who attend international palliative care conferences, whether or not there is certification for palliative medicine as a specialty, the volume of publications, and even the existence of specialist services for children. And we put these together into our ranking as well, as measures not just of the simple resources, but of the wider vitality of palliative care at the country level. Well, we had some discussion about how to weight the two measures in our ranking. And in the end, we decided to allocate 75% of the score to specific resources and 25% to vitality. Now, I'm glad there's a long distance between us here, because some of you may not be happy with the result that you see, but this is our best evidence at the moment. And I'd like to show you it. It hasn't been published yet. It's work that Dr. Centeno and I are still progressing, but which we feel begins to move us in the direction of a ranking of palliative care within the countries of the European Union. And I highlighted Italy, joint 11th with Austria in our ranking, with the United Kingdom at the top and Estonia at the bottom. A ranking based on the level of palliative care service resources and a measure of the vitality of palliative care. There are problems with it. It's a difficult thing to stand by and say this is absolutely hard evidence, but it's better evidence than we've ever had before. And it's evidence that we badly need if we're to influence policymakers. I also highlighted there, 5th in the ranking, Poland, one of the poorer countries, one of the accession countries, a country that has only developed its palliative care system in the wake of the collapse of communism, but where, with inspired leadership, with major influence on policymakers and recognition within the public healthcare system, it's achieved in a very short period of time a ranking of 5th place in the overall league table of palliative care development within the European Union. Quite a remarkable testimony to what can be achieved when you have the right strategy. Another way of expressing it here. Well, it's coming up to lunchtime, and I don't want to detain you too long. I began by talking a little bit about personal motivation. And in the time that I've been involved in palliative care for the last 20 years, I have been hugely inspired by the personal example of Dr. Cicely Saunders, who died 3 years ago this summer. And it was my great privilege to spend quite a lot of time with her in the last 10 years of her life. I helped to collate her archives and papers, and together we published a volume of her letters and her collected writings. And it's my ambition to go on to write a new biography, a full biography of the life of Cicely Saunders. And a few years ago, the Floriani Foundation